We would like to acknowledge the traditional owners of the lands on which we record this podcast, the Gadigal people. This is their land, never ceded, always sacred, and pay respects to the elders past, present and emerging of this place. Coming up on Remarkable Insights.
Technology is not a distraction for the physician. It's not a distraction in medicine. But technology is a tool that allows us to restore the time-honoured sacred tradition of the doctor-patient relationship.
Welcome back, or hello, first-timers. This is a podcast about disability driving innovation. I'm your host, Viv Mullen, and our guest is Dr. Dinesh Palipana, a man you'll love to hear from, but maybe not meet under certain circumstances. That'll make sense in a second. Dinesh, could we start by giving a visual description of yourself?
I describe myself as a caramel man, about 180 centimeters tall, usually found in grey-coloured scrubs, using a wheelchair.
Awesome. So I might just ask you if you could do a bit of an intro of who you are and sort of how you got to where you are today.
Well, today I work as a doctor in the emergency department. And I work in, it was at least at one point, the busiest emergency department in Australia. And I have a spinal cord injury. I sustained a traumatic spinal cord injury in 2010 as a result of a car accident. And it affected my fingers and everything below the chest.
And I suppose the position that you're in is really interesting because being in the medical world, perhaps, and correct me if I'm wrong, there might be some people that really sort of see disability through the lens of the medical model. And then you look at the social model as well, and you kind of realize within the medical setting, it's actually the social model that really dictates how people experience disability. And have you sort of had to face a lot of people with that real medical model perspective?
I don't even know if it's the medical model in a way, because like some attitudes have been so staunch. Even last week I had this conversation. I actually got an email from an educator in a high school who is trying to support a student who has a profound physical disability. They were saying a particular certifier of a program will not certify this student because they can't physically perform CPR. And this is one of the things that keep coming up in healthcare all the time. Can someone be a doctor or if they can't do CPR? And the thing is, in 2023, in a major hospital, particularly like Gold Coast or even ambulances, we have machines that do CPR. So they do compressions very well. They do compressions tirelessly, consistently, to good effect, while the human beings can do other work. So when you put something like this up as a barrier to someone being educated, it's such a small part of medical care. But sometimes this singular thing, this very simple thing, is used as a barrier to not allow someone to be educated, to let someone work. So it's things like that you keep coming up against, and it is a very frustrating thing to sometimes deal with.
I would love to know, throughout your entire medical sort of journey, as both a professional and a patient, how have you seen sort of technology evolve in relation to sort of disability in the hospital setting?
Oh, technology is evolving so rapidly. And in fact, just before we started this conversation today, I was on another phone call with a group in the US who is talking about ultrasound. Ultrasound is changing a lot of things about the way we practice medicine. But I'll tell you a little story about how ultrasound came to be in my hands. A couple of years ago, when I was working in the ED, I had a really difficult conversation with one of the specialist training colleges. After that, one of the emergency physicians, who was my boss, he pulled me up in the corridor and he said, "What matters to me the most is not these," and he pointed at my hands. And then he said, what matters the most is this and this. And he pointed at my heart and head. And he said, no matter what the rest of you does, my standard for you as a doctor is about you and what's inside. Then he took it upon himself to teach me ultrasound. And so I got this amazing machine where it actually just sits in my pocket, the probe, and it connects wirelessly to my big screen phone. And so I can actually look at certain things. And one of the things I can confidently do is just look for a baby's heart. So one night, this was a couple of months ago, in the middle of the night, it was about 2 a.m., a pregnant mom came into our department, and she'd been bleeding and she had some pain, and she was terrified that she was having a miscarriage. It was her and her partner, and they were so upset, I mean, the distress it's understandable. So I was able to get this ultrasound out and pop it on her belly, and suddenly we could see this little dude moving around with a little heartbeat, and suddenly everyone was happy, and the smile and the relief, and it is one of the best moments in medicine for me. And she said, do you love your job? And I said, yeah. And she said, even at 2 a.m., you love your job? And I said, yeah, especially at 2 a.m., I love my job. But, I think that kind of signifies what technology can do for a physician with a disability, but it also has a flow-on effect to a patient with a disability, because with a tool like that, for example, you can share what's happening. So you can actually make healthcare more accessible. And I think in 2023, that's what this is all about. Like, we have to empower our patients more. And when we see a healthcare gap, when we see a life expectancy gap for patients with a disability, putting more power in their hands to be in control of their own health, to empower people, is going to give them better outcomes. Technology is not a distraction for the physician. It's not a distraction in medicine, but technology is a tool that allows us to restore the time-honored sacred tradition of the doctor-patient relationship.
Dinesh, that is such a powerful moment. Thank you for sharing. It's such a cool story, particularly about the example of the use of your ultrasound. I'm curious to know, has there been any other examples of technology that you have had to use in an adaptive way for your work that other doctors, perhaps that aren't living with a disability, have gone, oh man, that is actually great and that will benefit me. I'm going to adopt that tool as well?
Yeah, totally. Really early on, I started using an iPad that had the electronic medical record. So I was using this iPad when I was actually a student and then an intern. I was using it in ward rounds and things. And rather than pushing this big cumbersome computer on wheels around, we were able to just pull up things really quickly. We were able to run around, and we had this iPad that had everything at our fingertips. And then there were things like I started printing prescriptions before it became widespread in our hospital. And, printed prescriptions, like if you think about it, how much room is there for error when you handwrite something? So these were legible. These were able to be read by the pharmacists. I started using dictation. So dictation not only allows me to be quicker, it allows me to write better notes and think better while I'm doing it. So some of these tools, other doctors have started using it now in our hospital, and it just makes medicine better. But there are some really cutting edge tools coming out now as well. So there is an amazing set of neurointerventional radiologists. So they treat things like strokes and aneurysms and things in the brain. They have a robot which you can drive and do a procedure in someone's brain with it. And you can actually do it remotely as well. So if you're sitting in Sydney, you could do it potentially in Cairns or somewhere like that. The cool thing about that robot is that the controls are totally workable by someone like me. So there are so many tools that have simple things like voice recognition that are being uptaken, but there's also some really cool things that are coming up that will be the frontier of medicine as well.
Where do you think the technology used in hospitals needs to go? What are your hopes for the accessibility and the tools that you have access to? Is it a place for Chat GPT? Are remote doctors going to be more of a thing using these sort of amazing robots that you speak of?
We have so many gaps, right? Gaps for rural Australians in healthcare. So we're still trying to figure out ways in how can we offer the same healthcare or the same quality, the same speed, healthcare to people living in rural areas, because at the moment that's a challenge. And then when you put intersections into that as well, so if you say have a rural Australian with a disability, if you have a rural Australian from a cultural and linguistically diverse background, once upon a time, our imaginations were limited by the technology. I remember when I was 10, 20 years ago, the speed of the computers and the power of the computers that were widely available limited what we could do. But today, that's not the same. We have a phone in our hand that probably has more power than multitudes of computers in a single institution 40, 50 years ago. So we can do so much. So today, we're only limited by our imagination, not the technology. So we have the potential to do so much. So I think we just need to enable innovators. We need to enable problem solvers to come up with solutions to go and do some of these things to solve the critical problems in healthcare. Technology is going to change the way medicine is delivered. And if we don't keep up, it's going to cause an issue.
And do you think that the reason you were able to see it so clearly is because you have had to use technology because of your spinal cord injury?
Yeah. I mean, even when I first started as a student and even an intern, we still had a lot of paper forms, but I actually scanned it into my iPad and digitized a lot of the forms myself, so we could still have the same thing. So yeah, I mean, I was, for the sake of efficiency. And actually, in my first year as an intern in the emergency department, I was seeing 25% more patients than my colleagues on average. So
wow. And that's a result of you using this digital tool instead?
Yeah, I was just finding workflows to make myself quicker.
I've only known you for a short while, but even the creative thinking that you have to improve the efficiencies of your workflow and the projects that you're leading, it sounds like you're constantly thinking big and of ideas and solutions. And I kind of hear that sort of message through my work with the disability community, is that people with disabilities are natural problem solvers out of necessity, and also because it's how sort of the creativity that is instilled in them when they're having to do this constant sort of barrier breaking. How much consultation do you see with people with disability in the healthcare system when you do see technologies being put in place at work and you see funding going towards certain projects? Are they tapping into the sort of the disability community and saying, what are your thoughts on this? Can you help us design this so it is accessible?
It is starting to happen. Institutions and project leads are starting to see the importance of this, and they're starting to realize that it's the whole nothing about us without us conversation. So I think it's starting to happen. It's probably not as ubiquitous as we would like yet. One of the other things I think is, in addition to consultation, is to actually empower people with disability to do this. And one of the most frustrating things to see are kids being denied opportunities to go through schooling and to go through secondary school and then to get into tertiary education because they have a disability. Like, that is so frustrating to see, because we're not even allowing some of these kids to explore their potential, to tap into their potential. And I think in addition to actually consulting with people with disability, we actually need to give people opportunity and equity to pursue education and to start developing some of these things themselves.
Dinesh, to finish the episode, I would love for you to share a remarkable insight, and that can be an advice, a quote, or something you would just like our listeners to leave with and think about.
I read this quote once, and I think it just sums up everything to me. And it was something along the lines of never accepting the world as it is, but daring to see the world for what it could be. If we took that and if we worked towards the world for what it could be, then I think that's how we create an amazing place for us all.
Thank you so much, Dinesh. It's been so wonderful to learn more about your story, and your insights have been truly, truly remarkable.
Thanks for having me, Viv. You are awesome.
Thank you to our guest, and hopefully you found your own remarkable moment. Make sure you subscribe to the podcast and follow our Instagram at remarkable_tech for unheard moments from this episode. Talk with you all on the next one.